There's a new clinical trial taking place at the University of Illinois Veterinary Teaching Hospital, and here with the details in today's Forever Family is Dr. Rachel Rivenberg. Dr. Rivenberg, thanks for being with us.
Thank you so much for having me.
Okay, so this is a brand new trial, one that has not been conducted before. Tell me about it.
Yeah, so we see dogs for amputations for a variety of reasons. One of the most common is cancer. Some other reasons are a fracture that is either very difficult or very expensive to repair, or some types of wounds that are very difficult to treat or are progressing despite what we're trying to do. And going through amputations is really challenging for owners, to see their pets go through that. And we're also a little bit limited on what types of pain medications we can give certain pets and pets in general. And so this is a study to kind of see, is there a surgical instrument that we can use that is going to make surgery faster, cause fewer side effects and fewer complications with the incision, and make them more comfortable after surgery. So just kind of another tool that we can use to provide good patient care and comfort after surgery.
Yeah, it sounded like there were two different methods. So that's what your focus is going to be doing, is comparing those two methods, right?
Yes, exactly.
So who would be a good candidate to be part of the trial?
Yeah, so really any dog that is amenable to handling in the hospital. So dogs that are very fearful or aggressive are a little bit challenging for us to pain score. If there's a specific wound right over the site where we would need to be doing the amputation, that's a limiting factor because that could interfere with kind of the healing of the surgical site. But really any patient that has any type of bone tumor or other type of tumor on the limb, a fracture that a family maybe can't or doesn't want to repair, and is a good social dog who is good with handling in hospital and friendly as a candidate.
So we're looking at some furry friends here who have experienced, I guess, an amputation. These are our little three-legged friends.
Yep.
So can you tell me about this cat?
I don't know this cat specifically, but we unfortunately aren't having cats in the study.
Okay.
It's dogs only, just because it's a little bit challenging for us to evaluate cats all the time.
Well, that was going to be my next
hospital.
question. How do you evaluate a pain score on an animal? Like, how can you tell just like if they're at, usually, when a doctor says, is your pain at a 1 or a 10, you can tell them. How does a dog tell you?
Yeah, so there's a couple of different ways we're looking at that. One is a validated pain scoring method. It is kind of a little sheet that you look at and it asks you questions. So it says, what is the patient doing when you go look at them? Are they resting comfortably? Are they whining? What do they do when you enter the cage with them? What do they do if you touch around the incision site? Are they getting up and moving on their own? That one's a little bit more challenging for this study because they're usually not getting up right away after surgery, but by the time they go home 2 days after surgery with some sling or harness support, they are getting up. And then I also have a tool called a Von Frey device that actually measures, it kind of has a little probe on the end, and it measures the amount of pressure that I place on it. So I put that probe on the patient's skin and put some pressure and see when they react to that, and that helps me to see how painful they are.
Yeah, because they probably aren't going to tell you.
Exactly.
It would be nice, though, if they could, for sure.
It would.
So this is obviously very exciting for you as a doctor, as a veterinarian. If people are interested and they think maybe their pet would be a good candidate, what do they need to do?
Yeah, they can just contact the University of Illinois Veterinary Teaching Hospital and get an appointment set up with our soft tissue surgery service. There is a financial kind of incentive. We do give a kind of a refund somewhere between $300 and $500, which isn't a huge amount, but it's something to kind of offset them being included in the study. And so they would come in for evaluation. They would have to kind of pay for their initial diagnostics if we needed any, and then have the surgery, stay in hospital for 2 nights, and then they would need to return for 2-week incision checks just so we can make sure that everything is healed well.
Okay, very good. Well, it's a great opportunity for our little furry friends out there if this is something that they may be needing, and we appreciate you coming, sharing that.
Well, thank you so much.
You're welcome. If you want to learn a little bit more about this clinical trial happening at the U of I with the Vet Teaching Hospital, we will connect you at CILiving.tv after today's show.